Hello, this is Howard Hillstrom, Senior Director of the Leon Root Motion Analysis Laboratory at Hospital for Special Surgery. Today's presentation is entitled Detecting Pedicle Screw Breach, a Novel Automated Computer Vision Algorithm. By way of introduction, pedicle screw breach has previously been determined by intraoperative spinal cord monitoring, intraoperative screw palpation with ball tip probes, or assessment of X-ray fluoroscopy or 3D imaging such as CAT scan or MRI. This study evaluates accuracy of a novel computer vision algorithm for detecting planned breaches. Medial breach distance was compared as measured by a computer vision algorithm, electronic caliper measurements on open dissection, and expert human measurements on CT scans. For methods, we used 3 cadaveric specimens ranging in age from 71 to 90. 2 experienced surgeons performed bilateral T2 to L4 instrumentation using robotic-assisted navigation. Screws were planned within pedicle, 1 to 2 millimeters clearance from the medial wall, abutting medial pedicle wall, 0 millimeters of clearance, or medially breached by 1, 2, or 4 millimeters. Postoperative laminectomies of each level assessed the medial pedicle wall. Electronic calipers measured the medial breach distance. Computer vision algorithm measured breach distance using the relative pedicle screw location to vertebral anatomical landmarks. Breach measurements were compared across each technique using confusion matrices and linear regressions. Tables 1, 2, and 3 illustrate the 3 confusion matrices, the first being CT measurement versus open dissection, where open dissection is considered the gold standard. The second is CV measurements, computer vision measurements versus open dissection. And the third is computer vision measurements versus CAT scan. Note in the sensitivity and specificity for table 1, open dissection had a sensitivity of 0.96 and a specificity of 0.95. Note in table 2, the computer vision measurements versus open dissection had a sensitivity of 1.0 and a specificity of 1.0. And then finally, the diagonal and off-diagonal terms were compared for computer vision and computer tomography, which also were predominantly on diagonal. Results were available on 85 screws, which were placed successfully and assessed for breach. Mean absolute differences of breach distance was 0.63 millimeters between CT and open dissection and 0.79 millimeters between computer vision algorithms and open dissection. The R value between open dissection and CT was 0.76, and the R value between open dissection and computer vision algorithms was 0.87. 40 screws planned as breached and 32 were measured as breach on postoperative CT. 12 identified as grade B, 42%, 13 identified as grade C, 42%, and 2 identified as grade D, 5%, on Gertzman and Robbins classification. 1 breach was not detected on CT. To conclude, this study introduced an automated algorithm for effectively measuring pedicle screw medial breach. Moderate to strong correlations for breach measurements were found between open dissection and the computer vision algorithm and open dissection and CT analysis. Sensitivity of breach detection was comparable between computer vision algorithms and expert human CT analysis. The computer vision algorithm automates the assessment of screw placement, offering a potential way to decrease analysis time and human error.